we're good. Perfect. So we are going to talk today about chronic disease and caregiving. And honestly, it's not, I realize it's not my strongest suit, because usually I have good ideas in my head, how to start, how to finish. So here I had to more, in a sense, stay back, look back and decide what the plan. So I found few articles, and I wanted, as always, share them with you. But overall, we'll talk today about how chronic disease affects people and their families, how it's all studied, not studies, but studied, and what support do we have for different conditions. And I chose just two conditions, diabetes and osteoarthritis, because diabetes obviously is quite familiar to me, and arthritis is very common. So I hoped to have a little bit information. So there was this big review. It's called Family Functioning Assessment Instruments in Adults with Non-Psychiatric Chronic Disease Systemic Review. And one of the first things they say that there is very little information on the evaluation of family functioning in adult patients with chronic non-psychiatric illness. And this article went on to study what is known. In general, they suggested that family functioning refers to social and structural properties of the global family environment. And family functioning can be defined as a degree to which a family performs as a unit to manage conditions, to self-organize and adapt to changes, resolve conflicts, demonstrate clarity, to establish and achieve compliance, respect limits, rules, values, and principles. Pretty much how we can deal with chronic disease if one of the family members has it, how we can adapt to that, and how can we deal with the conflict and so on. And this particular study, they reviewed instruments. And instruments, it's technically questionnaires that were utilized in different studies over the last 19 years. And the article was published in 2021, so it's quite fresh. They established more than 2,000 or 3,000 articles originally, but then they put in together only 14 that had good quality and were in English language. And as a result, there were 12 different countries that were studied here, and close to 3,900 people who were included. Majority of studies were probably about cancer, which I didn't even touch it. Some of them were about osteoarthritis, coronary artery disease, COPD, type 2 diabetes had several articles, rheumatoid arthritis, osteoarthritis, fibromyalgia, and pulmonary and rheumatic disease was another one. And it went through kind of looking at different questionnaires that were utilized, but technically it's not as important for us what were those questionnaires. And when I was thinking about the chronic disease, I wanted to mention about codependence. Back years ago, I was introduced to this wonderful book called Codependent No More, and author is Melody Beatty. And she kind of opened my eyes on relationship in families. And codependence is excessive emotional or psychological reliance on a partner. And typically it's one who requires support on account of illness or addiction. So frequently we think of codependence as related to addiction, like alcoholism or somebody with narcotic addiction or whatever else. But in reality, codependence is very common in all other family situations. And it's important not to be in codependent relationship 100%. Yeah, if there is occasionally you feel super emotionally, excessively emotional about this or that, that's maybe normal, but when it's becomes excessive, then that becomes more diseased relationship. And as a result of that, you may feel guilty, and at the same time, you may feel defiant. You may feel angry with the person in your family who either has that chronic disease or whatever other circumstances are. So therefore, I always suggest to read this Codependent No More book, because it provides a lot of good exercises that help you to resolve this codependence. And being not codependent is a wonderful state. And I feel that it's more mature relationship when you are not in codependent situation. And therefore, I suggest to read this book pretty much to everybody. In terms of diabetes, of course, that's kind of bread and butter of endocrinology. That's why I wanted to look what's available. And there was this one article about 20 patients with type 2 diabetes. And when and that was from patients, not from their relatives. But questionnaire found that many people downplay their disease, and what that causes, that many family members more likely not to understand what it involves. And I do believe same stuff can happen with all other conditions that you may have, because many people may suffer in silence, and their loved one may not necessarily even realize that somebody has some kind of pain or fatigue or whatever else the condition causes. So we all want to be to some degree heroes and do things more than we can, more than we can swallow, in a sense. So that's why we're probably trying to downplay things, but in reality, it's not giving as much good, I would think. Then there is second guessing, because diabetes may not be discussed, and patients and family assume create their own assumptions, and nobody knows what's happening in other person's mind, instead of being discussed. For example, with diabetes, frequently people have neuropathy. And if your partner doesn't know that you have neuropathy and you cannot feel where you stand, or that you have numbness or tingling, or you have pain when skin touches your skin, then that can be quite
this is about diabetes.
Yeah, it could be quite bad, because your partner may like place the blanket on your feet, but instead of, because they're caring for you, yes, but instead your reaction will be, oh my God, that you're hurting me. And that's can create different problems. So going it alone, you don't want to do it alone, because you cannot hold the full responsibility. And there are situations when involvement of your relatives is very important, because it helps you to recognize your symptoms way before you recognize them. For example, with diabetes, could be hypoglycemia, and your relatives may notice that. Same with other conditions, like with adrenal insufficiency, your relatives may know faster that you require your steroid dose compared to you yourself. So no regrets. Participants manage their disease with medications, but they kind of only to maintain family cohesion and good life. And it's, yeah, there are no regrets. On the other hand, I have, for example, one friend and patient who doesn't share with her friends and relatives that she has type 1 diabetes. And as a result, when she goes there to have a dinner, instead of having lower carb meal like she's supposed to, she would eat, because it's not polite not to eat what is offered. And yeah, on her part, there are no regrets, but on the other hand, it's a bad it can lead to bad complication for her. So therefore, I do feel that this is not doing good to a person who has diabetes. So providing other people good life for your, as a cost of yours well-being is not very good, in my opinion. So then, so here was another, some kind of article, a review article for about 11 years. And here was family members have influence on self-management of adults with diabetes, and support from family plays crucial role in maintaining lifestyle changes. Because again, imagine yourself that you are having diabetes and you're not supposed to have ice cream or cookies, and your partner brings ice cream and cookies to your home all the time. So it's very tempting. It's very, very hard to avoid this type of temptation. And you want to be, as a family unit, to be successful. On the other hand, of course, I understand if the other person doesn't have diabetes or doesn't have allergies to whatever, but because of you, they have to kind of sacrifice and not to eat certain things. In their eyes, it could be a big sacrifice, but in reality, who knows, this program of eating may be better for you anyway, even if you don't have diabetes yet. So, but yes, diabetes treatment also affects family life of family members in several ways, can cause different types of psychological distress, and more attention should be paid to family factors. Diabetes, as well as majority of other chronic conditions, will be associated with higher chances of depression. And if there are other factors like older age that makes things worse, when people start adding memory issues, because type 2 diabetes can be associated with memory issues, then that becomes even worse. So this particular study was in Chinese population, but I do think it will be similar everywhere else. Talking about different populations, there could be absolutely different realities for different countries, because our cultures are very different. Today, I had my friend, medical liaison, I haven't seen her for a few years, stop by, and we were sharing how things are, and she asked me if I'm proud of my son being a doctor. And in the Russian culture, it's not, we are not necessarily proud. We are happy, but not necessarily proud. So it was interesting discussion there. But anyway, let's go further. So I looked family support. So previous research found that strong family support indeed plays a positive role and allows people to achieve better blood sugar control, deal with stress and depression, and encourage, it's very important to encourage the adoption of improved life choices for family members, not only for person with diabetes. And family members can also provide assistance, help with insulin injections. Again, this is not only related to diabetes, it could relate to adrenal insufficiency, where it could be family members may need to assist with injection of solucortef, or it could be with musculoskeletal disorders. You may need to provide assistance with movement or anything else, and provide transportation to doctor's appointments. And ideally, this support should be shared equitably between family members, because otherwise, again, there could be a situation that one person feels that, oh, I'm doing all the things, and the other one is not involved as much. And that frequently is more case probably when we have elderly parents and several children. And I hear that as a provider periodically. There are some very good family, cohesive families where all children involved equally and there is no resentfulness. But there are some cases where you can hear that, oh, I'm the only one who's doing it and my sister is never involved or something like that. So I looked at CDC recommendations. So CDC is one of those central commissions that provides a lot of different education and information. So they suggest everybody to learn about diabetes. Again, you can put any other condition here. Learn about diabetes, about hypothyroidism, about osteoarthritis, learn about adrenal insufficiency, whatever. Learn about that condition, whatever chronic condition is there. No, diabetes or any other condition is very individual. It's not everybody gets exactly same symptoms. Everybody could be slightly different, and therefore you cannot expect that some person with diabetes has no problems, takes just one pill for 30 years and doing totally fine, and another one ends up on insulin within a couple of years, even if it's type 2 diabetes. So it's just, you need to give that grace and just realize that that can happen. And you want to, as a diabetic person, ask friends and relatives for help and listen what they can say about that. It's definitely, as a relative or friend of person with diabetes, go for appointments if it's okay, because that way you can learn more. And frequently people with chronic conditions have issues with memory, or if they're in pain, they may not necessarily pay attention, and they may not necessarily be able to absorb everything that physician provides. And frequently physicians talk in very medical language, and you need translation almost to that. So that's why it's good to have a couple of people at the appointment, and that will help to understand better what was talked to you about and what was what was the message there. Of course, try to give the time. Time is always difficult. With diabetics, it's disease that is not going away if you have type 1 diabetes. With type 2 diabetes, it's a little bit easier initially, but it can become more complex, and you still want to check the blood sugars, have a healthy snack, time to walk, time to meditate, and so on. And doing it together is always more fun. Avoid blame. The small, it's in small not because it's little, but because of my my computer issues. But avoiding blame is very big. I had a patient who I had to go for court to testify because her husband divorced her. She's type 1 diabetic, and I had to testify, and he was just pretty much blaming her that she just does everything she can to be in hypoglycemia coma or hyperglycemia coma, and she's intentionally had poor control, and because of that she lost her food and so on and so forth. So bad situation, but this avoiding blame is important. Of course, caregivers can get to point that they could be resentful and angry, and that is okay, but it's not okay to say it's okay to say, yes, I'm angry with current situation, but not I'm angry with you. And it's avoiding blame it if needed to have some psychological help and taking break. Those are super important steps for caregivers. And that's where this step back. In some cases, caregivers could be overbearing, and that may not be good for anybody. Again, you want to be a hero and save the day, but in reality, you are not helping your loved one to take charge of the situation. Maybe accept ups and downs. It's, as always, mood can be up, can be down if the person is in pain or sad, irritable. Um, those chronic conditions can create those moods. And you just want to step back a little bit and say, okay, it's not personal. And that's where being not codependent becomes very important. Because if you realize that that person is maybe acting out a little bit because they don't feel good, and it has nothing to do with you literally, even though they may tell you say something mad, or that's truly not about you. It's more how they feel.
I would like to throw in there that we often act that way towards people that we love and that love us, because you know you're going to be accepted by them. Most likely, whatever it is you're going through, you're more likely to be accepted with them, and you don't have to worry about, you think you don't have to worry about the rejection as much.
Yeah,
we just take it out on the people that are closest to us and that love us the most.
exactly. Yep. So, and always be encouraging. That's important to recognize that it's hard work to have this or that condition, and remind about the successes, because if we focus more on positives, even if there are small steps, that still brings that positive energy that starts thriving. And more you focus on positive, more positivity you bring, and more positive things will start happening. That's I'm definitely a believer in this secret book, and I do see that it definitely happens. Then it says walk the walk, which try to follow healthy food and fitness with your loved ones, because yes, it's super helpful for everybody in the surrounding to be on board, and as I said, not to be a saboteur or saboteur, I guess. Related to specifically diabetes, there's no symptoms of hypoglycemia, because as said many times, relatives know that way before even the patient realizes that they have it. For other conditions, it could be adrenal insufficiency, pre-coma or pre-crisis. And I bet some other conditions will include like seizure disorders. They may have certain behaviors that relatives know, and may recognize that before the person recognizes that. So I definitely encourage to join support groups, and you need to have support group for patients, and you want support group for caregivers. I found this AARP Family Caregiver Resource Guide, and you can on internet AARP Family Resource Guide, Google that, and you will find that website. It goes by different states, and see what is available. Technically, for patients, it's great because you understand that you're not the only one who has this particular problem. You may share certain tricks that may help you to deal, or you can hear from other people tricks and tips that can deal you with certain situations, certain treatments. So it's always good to have this community of like-minded people in a sense. But for caregivers, you want to have that caregiver support group as well, because being caregiver is not easy, and they do need time off. They do need time to enjoy its time on its own, in a sense, to have their own hobbies, to have their own I would say life, but yes, your life is shared, but they still need to have this separateness, so they will have more healthier and more adequate psychological, I don't know, Lisa, say something here, because you are, as a social worker in the past, you probably know exactly what I'm trying to express here.
Well, I think that, it's hard to, in our society, I think, to spend time and energy on ourselves. We're always so judged on what you're producing and so many other things. And it doesn't seem like we value that rest. Consequently, we don't often stop and say, oh my gosh, my caregivers are so fried that, I mean, you've had to point it out to me a couple times when Ted has just been so fried that he couldn't deal with anymore. And when it's chronic, I you might be okay with all of those components of being supportive, not just from caregiver to patient, but patient to caregiver. You can only go so far. And they need to know, just like I need to know. I mean, I'm normal in a support group for people who have AI. In other support groups, not so much. And it depends on how accepting people are as to whether or not I or a caregiver can join a support group. And when it's chronic, you might be great for a month or so or a year, but when it's for the rest of somebody's life, I think it's exhausting for caregivers. And they really don't want yet one more thing to do or one more group to go to. But I do think that the internet stuff has really helped people get support, both as patient and as caregiver. And that walk in your talk thing is so hard. I can do that so much better for other people, but doing it for myself is really hard because I may know, like, I would work, I could work 60, 70 hours a week. And yet I would tell my patients and families, don't do that. You really need to do something for yourself. Have a date night, go out with the other kid or whatever. So I think that this has helped us with getting support. But at the same time, I know as we start to transition back into more people at work and more children at school and more normalized classes, that it's going to be hard for us, both as patients and as caregivers. And that's where I struggle, is how do I support my caregivers? Because it's not just my life partner, it's my kids. And
Yeah. No, I think allowing them to have that time off where they can go out and without guilt have fun, because there's nothing wrong with going and having boys night out, girls night out and have maybe even few days out so for travel, because people with chronic conditions may not be able to accomplish you at whatever trip, but maybe you want to go to that trip. And again, that's where being not codependent helps tremendously. If you have that healthy relationship where one person recognizes that it's okay to let the other one go for a night with boys in a bar, or go for kayaking with some cousins or whatever, brothers and siblings, and so on and so forth. So because frequently caregivers do feel guilty leaving their loved ones at home, but unfortunately it needs to be done. And there are resources in communities and through insurances that are available that you could take some even time off and have caregiver medically assigned, I guess, caregiver for a few hours a day or however it's needed. Of course, insurance is always crazy, so it's hard to say. I know Jennifer was here and they have some issues, had issues with that, and it's pretty much just not always easy. But I know
if you have a chronic condition, you should always ask. See, this is I do it better for other people. You should always ask for a medical case manager through your insurance company. I was good at what I did. and I don't say that about much about myself, but the case manager I got through Aetna, which is my umbrella policy.
Yeah.
She's so kick butt. It's not funny. She is amazing. And I wouldn't be getting a new pump if she hadn't been on the team of people with Dr. Goldenberg who were going after the insurance company to pay for it.
So no, it's definitely a great idea to have that medical care liaison to help with that. So anyway, a little bit switching to osteoarthritis. Just this morning, I found this study. It's a study from Michigan. Sounds like was maybe questionnaire or something from Michigan community. And they reported that 70% of people older than 50 have joint pain. We used to have in Russia saying that if you wake up, if you are 50 and older and you wake up and you are not in pain, you are dead. So it's kind of sounds like close to be true to at least 70% of people in Michigan community. And those 70% of people with joint pain, they were quite comfortable treating it. So in general, 66% used over-the-counter medication like Tylenol, ibuprofen, naproxen, and so on. 26% were taking supplements, and I wish this number was higher because frequently supplements have much better, much less side effects in a sense, like curcumin, Boswellia, and so on. Then 11% reported use of cannabidiol, which is CBD oil, and 9% reported using cannabis. And I don't know, Michigan does have medical cannabis, so I'm not sure if this was medical or was just recreational, but that was the results. The guidelines in general for osteoarthritis, they do support like weight loss, exercise management, and in patients with joint pain here, about 64% reported using exercise and 24% suggested that they had physical therapy at some point. This study is from Nigeria, and they looked at depression. And again, 42% of people with arthritis, with knee osteoarthritis, had depression, and 84% of people with depression had poor sleep quality. So of course, if you are in pain and if you are depressed, then you don't sleep well. And as a result, your energy is bad, and then you have low energy and it's hard to function. So that kind of outcome of that study. So I was looking at different support groups for arthritis. So apparently September is Pain Awareness Month. So here it is, be aware of the pain. Arthritis Foundation has a lot of good information. And then I was looking at arthritis support groups, and only on Facebook, this is a copy from Facebook when I put arthritis support group, RHX, women with rheumatoid arthritis, 25,000 members. Autoimmune arthritis support, 9,000. Arthritis inflammation, so there is smaller groups. There is a rheumatoid arthritis group with 75,000 members, and so on and so forth. So you can find all kinds of support groups just on the Facebook, and that virtual reality that we are moving toward metaverse, that's becoming true reality to a lot of people. And if people in the past had mobility issues, could not leave houses, now if they have computers, cell phone, connection to internet, they could be connected to thousands and thousands of people. And again, that provides so much positive, starting from learning what it is, learning how to deal with that, learning that you are not the only one. And I hear one of the questions when people get whatever condition, why is it me? Why did I get that? So here you kind of overcome those questions, and that becomes much easier. I think I didn't have any other slides here, but I think we'll stop sharing and stop recording.